So, John, I have a number of patients who I see in both the sleep clinic and as a GP who ask about melatonin as a treatment for insomnia. And I've always thought this is quite a sensible treatment, because if you think about how sleep's controlled, one of the main systems controlling sleep is the circadian rhythm. And this is divided into a wake phase and a sleep phase. And the sleep phase, there's a dominant hormone, which is melatonin. So it makes sense, I think, that if you take melatonin, that you would sleep better at night. But I know in reality, it's just a bit more complicated than that. Do you have any more detail?
Absolutely. So, as you rightly say, you would expect enhancing the melatonin that we produce at night time will make us fall asleep. If you look at the data amongst all populations and these big studies that have been carried out, when you give melatonin to people with sleep problems or insomnia, they don't really fall asleep as effectively as you'd expect them to with the melatonin.
Okay. And so that's sort of speaking in general, but are there more specific patient groups or other conditions besides insomnia that you would find a use for melatonin?
Yes, so some people benefit from melatonin more than others, and certainly we know that people with ADHD who are young, and sort of teenagers, and also those who are older, when you give them melatonin for sleep, they often sleep better. And actually for conditions linked to things like jet lag or moving time zones or shift work, you can use melatonin very effectively to try and help move the clock or stabilise a clock. So that's where I'd recommend using it.
Okay, so more helpful in conditions like jet lag, and it sounds like in general, while there are specific patient groups for whom melatonin might be a better treatment for chronic insomnia, that in general it's not that helpful and certainly doesn't compare to other treatments such as CBT for insomnia.